UnitedHealthcare recently announced a very controversial decision to drop thousands of Connecticut doctors from its Medicare Advantage Plan network. The move has angered and confused many patients and doctors.
Can you imagine?
No.
Earlier this month, the Fairfield and Hartford County Medical Associations filed a federal lawsuit trying to block this move by UnitedHealthcare. And our guests are Dr. Bolapalli Subbarao, president of the Hartford County Medical Association, and Dr. Prasad Srinivasan. He's also a Republican state representative from Glastonbury. First, I'd like to ask whichever one of you wants to answer, why is this happening? Why is UnitedHealthcare doing this?
I think the reason they're doing that is greed. You know, this nation is based on the principles that we all need to be and should be profitable. To make a profit margin is what this country is all about. And it's fair, it's equitable. That's one thing. To take it to another extreme altogether and drop off the most vulnerable of our population, people who need so much medical access, to me, does not make any justification other than the fact that unfortunately they cost more because they need some more.
I was going to say, so can you explain why they would have more profit by dropping these
Because
doctors?
these are people with more medical needs. I mean, these are patients, chronic patients, your dialysis patients, your patients who need chronic care, who need special surgery and so on and so forth.
Medicare.
These are Medicare Advantage patients.
Yes,
right.
Okay.
So this has got nothing to do with physicians, because these same physicians are on that list for all other insurances through them. You know, you are still a provider through United for patient A, patient B, patient C, and you can go on and on and on, because they are on Medicare Advantage. It's only this subgroup of people that are dropped. And the irony is these physicians have made, the ones who are dropped, some of them have made that excellent shot. You know, when they rate us all the time, and they rate us on multiple criteria. And they could have rated Dr. Subbarao and
keeping expenses down and that sort of thing.
Yeah, exactly.
That's a big distinction.
What is there's a federal law, obviously, it's a federal case. So what is the law here that you're citing in this case?
I think I just want to add a little bit about why they are doing this. They are doing this because they can. They can, so that they can pick on the vulnerable, and also they have been able to walk all over the physicians. They are doing this because they can, and the greed and everything else that follows. What are the laws or
the laws that apply to this situation?
Here, I think the Medicare is administered by the federal. So we think that they haven't given proper notice. I think this is a serious betrayal.
When did the doctors find out that they were, and they were going to be dropped in February?
Yes.
February, right.
But they're already getting the letters that you are being dropped. And also they have taken out the physicians' names from the list. And sometimes they take it out, they put it back. In fact, it is comedy of errors.
So the doctors don't know whether they're in or out.
Right.
And the patients don't even know what's going on.
Exactly. And I think this is an access issue, this is financial issue, this is, all around, they are betraying the trust that the public, I think the patients, the doctors, all around, that they are kind of, this is such a betrayal. Doing this I would call this a medical tsunami. More than 2,200 doctors are being dropped, and my understanding is there could be more. Where are these patients going to go?
But couldn't you just mention that they're doing it because they can, and couldn't doctors, I'm just thinking off the top of my head, but couldn't doctors, and it would take, they might have to feel some profit hurt themselves, but couldn't they say, okay, well, if you're not going to let me take care of this patient that I have because they have this insurance plan, well, I'm not going to take care of any of these UnitedHealthcare patients. Obviously that would cost them, but that could be a stand that they could take and say, well, we don't accept UnitedHealthcare.
Oh, definitely. That's, your option that we don't participate, we the physicians don't participate in any of their plans at all. But that is very short-sighted. Not just the money factor, but you're now adding on. I believe in Weaver, Dr. Subarao and I were down in Fairfield County when they had their first, the town hall meeting, and we were told even then, this was a couple of weeks back, that 60,000 people in our state are already going to be affected, and we still don't know how many people are going to be. 60,000 people are impacted by this, is what we were told.
And many of them don't even know this yet.
They don't even know, and every time they go onto the internet, today they are told the doctor is on, they call, and tomorrow they're told the doctor's not on, and there's no answer, there's no feedback. About a couple of weeks back, 3 weeks back, the Office of Healthcare Advocate and myself, we sat with senior management in UnitedHealth. Great meeting. It's a teleconference. We met for about almost 45 minutes to an hour. Very personable, very pleasant, and answered, why this, that, and the other. We raised all the issues 3 weeks ago, or even more than that. We have not got a response back to this day. Not one question that Vicky Veltri from the Office of Patient Advocate and myself, we sat and talked. As you know, our entire Constitution...
Well, their lawyers probably told them not to talk to you because it's a case that's pending.
Our entire delegation, at the federal level, has reached out unanimously to them. And Senator Blumenthal informed us at the meeting down in Fairfield that they haven't heard anything from either, and neither has our Attorney General's office. So we are all, the physicians, the legislative officers, they're all working together, because this is, as Subarao very appropriately put it, a medical tsunami, and this is wrong.
Yeah, and let's just take one more minute to talk about the concerns that you might have, because now it starts to affect people's medical decisions in health.
It is. I mean, it is a major concern. In the sense, at one level, they are kind of shortchanging the patients. At the other level, they are slandering the doctors. Initially, when they sent the letters, they said quality and cost concerns. And then we asked, what do you mean by quality?
Where's the evidence?
And then they say, where is the evidence? And then they say, no, it is not the quality.
Well, okay.
Now it boils down to cents and dollars. And I think that is where they are betraying the trust. And I feel not only that, I think that they are actually not even minimizing. They are just ignoring the relationship between the doctor and the patient.
And what are you asking for in this case? And I apologize, we're going a little long on this, but what are you asking for in this case? You're asking for all these people, all these physicians to be reinstated so they can be with their patients? Do you want money damages if they're not, or what are you looking for?
We are asking for temporary injunction, that is the TRO.
To stop the plan.
Yeah, temporary restriction order. And then we want to be partners in this. We want to discuss, we want to communicate. If there are cost concerns, if there are quality concerns, whatever it is, we want to know, because we want to be the advocates for the patients, because they are not going to be able to advocate for themselves. They don't even know what is going on. And I think what we are doing, this campaign, and also, by the way, I want to invite people for the town hall meeting on November 26th.
Where's that going to be?
It is going to be in West Hartford Town Hall. At 6 o'clock at the Town Hall, 50 South Main Street.
Okay.
All right,
well,
we're
thank
out
you
of time,
both. Thank you. Yes, we are way out of time, but this is so gripping, this situation. Thank you,
Absolutely.
doctors, both of you.
Thank you very much.
Thank you. Yeah.